Welcome to week 1 of tips for stress reduction. This week we're going to cover just the basics of breathing. And so we're going to go over each tip individually, but before we do that, I want to cover a few general concepts related to breathing. So first we're going to look a little bit at the mechanics. We're going to bring out my friend Ronnie the rib cage to show us here. So when we breathe, we have two phases. We have the inhalation and exhalation phase. As we inhale or take a breath in, we see that ribs move up and out, and this front to back dimension of the rib cage expands as well. Then as we exhale, we have ribs that move down and together, and we're going to see a reduction in that expansion that we had from the inhalation phase. Now, that's the mechanical perspective. From a neurological perspective, breathing is a function that can both be subconscious and conscious, which is the cool part. So usually it's operating in the background as part of what we call our autonomic nervous system. And this reflects the state that we're in, including a state of stress that we're in. So we can often be breathing in a way that reflects this stress. But the cool thing is that we can actually bring this into our conscious awareness, and we can control our breathing, which can be a way that we can hack that part of the nervous system to actually reduce our stress. So this leads us right to our first bullet point here, which is we want to breathe in a way where we're breathing very silently and gently. And there's a couple of levels to this. So if you can think of someone next to you that was breathing, if you could hear them breathing, you would say this person is working somewhat hard to breathe. And so that's one level of it. Now, if you can think of listening to yourself breathe or feeling yourself breathe, if you can feel yourself breathe or hear yourself breathe, there is still some work to be done to be able to reduce that work of breathing down to the lowest level. And if you're able to make that as silent and gentle as possible, you're also going to reduce your stress along with it. Now, going along with that, in terms of mouth breathing versus nose breathing, we know that when the nose breathing is used as opposed to mouth breathing, we reduce the work of breathing, and we're also more likely to use our diaphragm instead of accessory muscles like our neck. So we want to breathe through the nose whenever possible. Now, if you're having a tough time breathing through your nose, what you want to do is you want to try your best to breathe through your nose, but as gently as possible, because actually as we increase the effort to breathe through the nose, we actually increase the turbulence, we can irritate the nose, and that will actually stop us from opening our nasal passages. Whereas if we go just nice and gentle and we just are patient, even if we have a slightly stuffy nose, typically that nose will open as we're reducing that turbulent flow. Now, moving to this third tip, we're not only going to reduce how hard we're breathing, but we're also going to reduce that overall rate. We're also going to bias towards this exhalation phase of breathing, because that exhalation phase is going to bias our vagus nerve, which is going to stimulate the anti-stress response. So as we exhale for a nice long time, working up to just about twice as long as the inhales, we're going to stimulate that vagus nerve, and we're going to slow down the total number of breaths that we're taking in a minute. This fourth tip, to do a pause between breath, is going to tie right back into that same concept of taking less breaths per minute. So as we do a gentle pause at the end of the inhale and the exhale, we are going to get less breaths per minute. That's going to help stimulate that anti-stress response. So we're not only not breathing as hard, but we're not breathing as many breaths. Now, this last tip will bring Ronnie back out to explain a little bit. Because as we see, here's the rib cage. Our lungs go all the way up here, but our neck starts right here. So a lot of times when we're stressed, we start to increase the amount of contribution from the neck, and we start to pull up as we inhale with the muscles in the front side of the neck. And so we want to reduce some of that neck activity. We can bring a little bit of awareness to the breath through an activity like this. So as we exhale, again, we're going to get that decompression of the rib cage. And then if you keep your hands just gently on the front of your neck as you inhale, you're going to notice to see if there's any excessive pulling up of that rib cage. If there is, just breathe a little bit easier and imagine breathing a little bit lower. Then you're going to do another exhale. You'll feel everything drop. And then on the inhale, try to feel that the neck is not becoming involved. So those are our 5 tips. In terms of how frequently you're going to practice this, it's going to depend on kind of how you're breathing throughout the day and how much you need it. But a good place to start is 2 or 3 times a day, just as a recalibration, maybe in the morning, maybe at lunch, maybe before bed, and then building up until this style of breathing is something that you're doing at rest. And then over time, you should find that this will dramatically help reduce your stress and make you feel better just at rest. So thanks a lot for watching this week's video. Stay tuned for next week's video, where we're going to talk a little bit more about posture. See ya.